The following program is a collaboration between Whatcom Community College and KMRE News. Today's KMRE conversation is with the primary candidates for the Whatcom County executive race. With 6 candidates in the field, we want to help our listeners understand the differences between the candidates by giving each of them a chance to answer the questions that are on our listeners' minds. Each candidate was given a total of 20 minutes to answer the same questions. Today, we are presenting all the candidates' response to one of those questions. You can hear each candidate's complete interview by going to kmre.org. In the last 3 years, the health department has nearly doubled in size and dramatically expanded its scope. This has led to some complex administrative challenges. For instance, the department has had a turnover rate of over 50%. Have we expanded the health department due to the pandemic, or is this the new normal? How will you set that department up for success?
My name is Misty Flowers, and I'm running for Whatcom County Executive. I think that there has been a huge expansion because of the last 3 years and the funding coming in for that through ARPA funds. But at this point, that funding for the emergency order is over, and we need to reevaluate how we are spending that money. I think that there has been a huge influx in funding for the health department without seeing the solutions that would show us a healthier, safer community. So I think we need to reevaluate that and potentially use some of those funds that have been ballooned into other areas, like more affordable housing, like other services, mental health services, recovery services for addiction. There's so many needs that we have in our community that I think those funds would be better spent. And I do think that the health department obviously has a place in our community, but I think that they need to refocus their priorities on their job of making sure that the public is safe and healthy across the board, and really do their job working with the government and with the public to make sure that those needs are met.
My name is Barry Buchanan. I'm currently the chair of the Whatcom County Council, and I am running for Whatcom County Executive. I think the expansion of the health department there was a lot that was pandemic related, but I think the response systems division was more in response, not to be a pun there, but in response to the community's need for greater engagement by non-uniformed officers, for instance, on a call that is a behavioral health oriented call. We're now sending professionals out with law enforcement to take those calls. So the response system division has taken on a lot. They've taken on the GRACE program, the LEAD program, which was previously in the prosecutor's office. So they're really trying to wrap all that into one. I support it. It's going to be some growing pains. I know that. As executive, I would always have an open door and lend my team building skills to that effort to try to help that department.
Well, my name is Satpal Singh Sidhu, and I've been on the council for 5 years, and then I became county executive starting 2020. It is a complex question and complex answer. When I got on and I hired the new director of health services for Whatcom County, and it was like starting of pandemic when we hired Erica. And it was a natural expansion of that. Every eye, every brain, every thing concentrated on what is the health department going to do, because it was a community health problem and squarely fell in their place. And they were the lead on the emergency operations. And so that was a natural expansion of that. But at the same time, the health department takes only 7% of their budget comes from the general fund. A lot of times people may not know these facts. And rest of the funding is from all the programs which have been coming from federal government, state government, and other sources. So when they say that we should have a program because this is, let me back up. This is a department has changed its name from Health and Community Services. This is the new name. So there are several community services which would otherwise have been done other places are now into this department. Community services like affordable housing, sheltering people. So these are all part of the health department. Same thing is parts of pandemic, parts of Healthy Children Fund. All these things are part of the health department. So the funding source, behavioral health, GRACE, LEAD, alternate response. All these things have wrapped up into that. So this is not just that the department has expanded. I think their services, the array of services they provide is also expanded. So, and we did look at the last biennium budget, and it came down to that no more than 7% of general fund is going towards these services. And so yes, it is a new challenge for us. That the services in the community the need. You see the homeless problem, you see the mental health problem, you see the police response problem. These are all combined into, and I'm happy that we are able to actually address all these issues through a department in a coherent manner. So that's what the reason is, that there is an expansion of that department.
Yes, my name is Alicia Rule, and I'm currently serving as your state representative. Well, I'm really glad that you are talking about the health department, because I want people to really understand the scope of what's happening in the health department. And all of these things we've been talking about, when we're talking about homelessness, mental health crises, addiction, all of these things land in the purview of the health department. So it makes sense that our most important crises and problems would have enough staff to be able to support it. It also makes sense that it's difficult to keep that staffing because it's really hard work. But it's even though it's difficult, this is what I've been doing my whole career as a social worker and running programs in the human services. I am very aware and very accustomed to doing with less, and I've been able to really get to outcomes and lead teams under really difficult circumstances. So I think partly what we want to do is make sure that all those staff that they're getting exactly what they need, the tools to do their job and being held accountable for the work, so that they're producing the outcomes that we need for our community. But you do that in a way that you're managing those folks really with a lot of encouragement and giving them tools and allowing them to do the work that they already really love to do and to thrive. And so I'm excited for that challenge. We need it. There's nothing more important right now than, again, going back to people being safe, people living right now currently in subpar conditions. We have to address those with bold action and do it very quickly.
My name is Dan Purdy. I'm a candidate for Whatcom County Executive. I believe the health department is running roughly 139 employees right now. Obviously, we can all fact check that ourselves. I haven't spent too much time going through the actual department itself or meeting with the individuals who are working there or are leading that. I would like to get more information before I make any final decisions. That's what a CEO does, is that individual comes in, they take a view of the landscape, we talk to people, get through the perspectives, and then we make decisions. I think it's really important to understand that the pandemic was a one-off for us, and it was of historic proportions. So whether or not we were staffed up just for that 3-year period or not, I think that remains to be seen. If we're creating kingdoms and fiefdoms, that's something that we need to really take a closer look at, because we don't want to be taking taxpayer dollars and putting them towards programs or additional unnecessary expenses. But I don't have all the answers quite yet on that.
Thank you for listening to this KMRE Conversation with the primary candidates, a collaboration between Whatcom Community College and KMRE News. You can hear more from each of the candidates by listening every day after the 5 p.m. news or by going to kmre.org.